Good afternoon, ladies and gentlemen. My name is Nemeka Onyeka Obialiri, and something happened now that triggered me to do this clip. A relation of mine called me. He has some health challenges, and he was complaining that he had not been able to step out for 2 days. My heart went out to him, and I asked him to go to hospital to go and run a test and treat himself. In fact, over 100K just left my pocket this afternoon, running test, and then the drugs and the injection, over 100,000 naira. And now I ask myself this question: if this guy does not have access to somebody like me, who God has given little capacity to be able to attend to needs of others around me, what will have happened to him? Now, there is this urgency for us to fix our health and the education sector. It's very urgent for us to do this. We need to declare a state of emergency in our social investment sector. Health and the education of our people must be the topmost priority in every expenditure plan that we make going forward. Nigeria is the only place where education and the health does not attract up to 40% of national budget, policy and plans of governments across the 3 tiers of government in any democracy anywhere in the whole world. Look at South Africa. South Africa, with a population of 60 million people. Life insurance market size in South Africa is about $36 billion. Health insurance in South Africa is about $13 billion and projected to grow to $25 billion by 2030. In Nigeria, it will shock you that the size of our life insurance market is less than $1 billion. In fact, only less than 1% of Nigerians have life insurance coverage. The health sector is even worse. We have less than 3% of Nigerians, not even up to 3% of Nigerians that have health insurance cover. And the market size of our health insurance market is about just $453 billion. And we have 217 million people. Singapore, with a population of less than 5 million, with 5.6 million people, have a health insurance market that's almost $1 billion sized. And in fact, 63% of Singaporeans have health insurance policies. In South Africa, it's even 17%, which is very low. In Nigeria, it's less than 2%. We need to prioritize education and health if we actually want to grow this economy. Are you guys aware that life expectancy in Nigeria is 55 years? In South Africa, it's 65 years. In Singapore, it's 84 years. Do you now understand why the Singaporeans have life expectancy of 84 years? Singapore in 1965 was more backward than Nigeria. Life expectancy in Singapore at 1967 was just the same level we are today in Nigeria. GDP per capita was less than $3,000, $2,000. Today, GDP per capita in Singapore is almost $50,000. Life expectancy, 84 years. The average Singaporean is short of living at least 80 years. Nigeria, if you get to 55 years, we thank God. That is how life, short and brutish life has become in Nigeria. But we need to build up the health and the education sector. We need to invest minimum 40% of every annual expenditure across the 3 tiers of government on education and health. That's why we call it social investment. It's an investment that triggers every other investment that can help to unlock the massive potentials in this country. Look at even the pension fund regime. Our pension fund market is just about very shallow. We have less than 5-6% of Nigerians being covered, because there's even a law that says, but there is no consequential penalties. The Pension Act states that if you have 3 employees, you must enroll them under the contributing pension fund regime, and you must also provide life insurance coverage of at least 3 years for them. But there is no consequential penalty. We've tried as much as possible to reach out to PENCOM, to reach out to the PFAs, to reach out to the National Assembly under a private sector-led intervention arrangement to amend the current pension fund law to make it consequential. If you have 3 employees and you do not enroll them into the contributing pension fund scheme and do not provide them with life insurance cover that covers 3 years of the annual emolument, you are liable to 2 years imprisonment without option of fine. And of course, set up offices in all the 774 local government areas under a private public partnership arrangement. We have even created a digital platform to drive this. But sometimes when you say these things, it will enter to the left, right through the left ear, and it will pass through the right. We are working with even a Swiss firm, a Swiss firm and a Chilean firm who are very experienced in this, and we have written proposals, made pitches on how we can help the governments of the day to draw up a massive program that can help us ramp up the pension fund assets of Nigeria to be at least 50% of GDP over the next 8 years. See, the problem with the health sector and the health insurance system in Nigeria is because there is no structured and proper regulation that creates seamless handshake between primary and secondary providers of healthcare services and the health insurance companies. I have heard a lot. My own wife is a doctor. She has 3 clinics, eye clinics. I've heard her complain several times, enrollees of health insurance companies will come to our clinic, they will receive treatment, the health insurance companies will not pay. Sometimes some of them even owing her for 1 year, some are even owing her for 2 years. This should not happen. If we have a robust regulatory body in the health sector that ensures a seamless handshake, there's no way under law. The law should be amended. Once a primary or secondary healthcare provider provides healthcare services to an enrollee of a health insurance company and submit that bill, if that person or if that company is not paid within 30 days, the insurance company will have to be paid interest of at least 20% every per annum, every day, for the rest of the days that they still hold that money. We need to put in place the right laws. We also need to put in place, states should have to come up with a PPP structure to provide health insurance coverage for majority of their citizens. At least 40% subsidize health insurance by 40%. You see, the best investment you can make in life of your citizens is investment that has to do with education, with health. We can actually grow the health insurance markets of Nigeria to about $10 billion over the next 5 years. We can actually see, if we have a robust health insurance market and we have a robust regulatory body, a very scientific regulatory body that ensures that health insurance providers pay for the service by rendered to their enrollees in time and timely. It will also help the primary and secondary healthcare providers to equip and to dispense services without being made to go bankrupt. And then government should also provide. See, I've been trying to reach, and I pray this message is especially for someone like Alex who listens. Abia State can lead on this. Abia State can decide can create, and they should create, a private-public partnership enabled health insurance company in Abia State. A health insurance company that subsidizes 40% of the health care needs of citizens of Abia State, and again set up a health insurance trust fund, just like a security trust fund. Let me tell you, a health insurance trust fund in Abia State under the government of Alex will attract a lot of funding from donor agencies, from diaspora Abians and diaspora Nigerians, because we trust him. He has trust capital, he has confident capital. People will invest, people will put money there to help him develop the health sector. And again, there are loads of medical doctors, diaspora, that are willing to try to see how they can come in and help. You should set up at least primary health care centers in half of the electoral wards in Abia State under PPP arrangement. I have been speaking to loads of diaspora doctors who are willing to come and help under a private-public partnership arrangement that will ensure quality health care. Tertiary health care is just like ABSUT should be allowed to partner with the likes of Elsmer Tel Aviv, so that it can become global best diagnostic health center. They can attract nothing less than $20 million into ABSUT. I have been talking to Elsmer Tel Aviv, and Elsmer Tel Aviv, they are one of the biggest equipment suppliers. They are willing to come into ABSUT, supply them with $20 million worth of equipment as partners. Of course, people will travel all over from the southeast from Nigeria to go there and receive sound medical care. Now, because you have quality medical care within those systems, you can use the health insurance framework to subsidize for those who cannot be able to pay, and those who can pay will charge them maximally. And of course, we can also tie this thing to enumeration system, where we enumerate every citizen of the state, every resident of the state. Under, they will have a ID card that is linked to their TIN. For you to access this, you must have your tax identification number. It will also help us to be able to tax those who are able to tax, or who are qualified to pay tax, and to also provide social welfare support for those who are not earning enough to be able to support themselves. Nothing stops us from doing the right things. We can do the right things. Abia State has set the pace. Alex Oti provided 41%, at 40% of the state budgeted expenditure for health and education. Of course, you should take it a top notch. Engage a lot of private sector partnership in developing healthcare, primary healthcare facilities in the state, even telemedicine. Look at the tertiary institutions, in the health institutions in the state, like Absolute. Work with Tel Aviv. I can give them the link to Tel Aviv so they can, to ASMED, so they can link directly and discuss with them. They will supply you $20 million worth of equipment under a private public, because they are not charity organization, they want to make money. But you will have a world-class tertiary health center that will meet the world-class need. Most people that will be traveling to India, to other places, will come to Abia State for their healthcare needs. We need to build up Nigeria. Health is wealth. Thank you.